Texas faces a severe shortage of primary care providers, a problem that stretches from our rural areas to our major urban centers. The Texas legislature is currently considering a dramatic plan to address this shortage by providing financial incentives for those willing to serve in medically underserved areas. Healthcare providers, patient advocates, and community leaders from the Port Arthur area gathered at the Gulf Coast Health Center to lend their support for this historic proposal.
Arthur's mayor joined local healthcare providers and patients today in pushing for more doctors and other medical professionals for her city. Mayor Bobby Prince called on state lawmakers to establish a fund to help remedy a shortage of doctors in some parts of the state, including Port Arthur. Prince says more than half of Texas counties need more primary care physicians. House Bill 1876 would create the Texas Healthcare Access Fund. The fund provides financial incentives for health professionals to practice in underserved areas.
It's important for Texas because we have such a great shortage of medical professionals that are working in primary health care. However, because of the economic situation right now, people are working but are not being able to get health insurance. Others have been laid off and do not have health insurance.
The fund would help doctors and other healthcare professionals to pay off student loans in exchange for a full 4-year commitment to practice.
Healthcare professionals came together in support of a proposed state law to attract more primary care physicians and dentists to rural areas. Clinic administrators hosted a conference at the Gulf Coast Health Center in Port Arthur to raise awareness about Texas House Bill 1876. Jessica Holloway reports the bill would address the primary care shortage problems in the state by reimbursing medical students.
Good morning, and thank you for attending our press conference about the healthcare provider shortage that we have in the state of Texas.
These doctors, patients, and health officials are standing up for something they believe in.
And the reason we're trying to get this legislation passed,
they support House Bill 1876. They believe it'll improve health care in Texas.
So that when patients need health care, they can access that health care as readily as possible.
The Gulf Coast Health Center in Port Arthur has openings for health care providers, but it's hard to attract qualified applicants.
It will help us be able to recruit more doctors, nurse practitioners.
According to the Texas Department of State Health Services, in 2008, 26 Texas counties had no primary care physicians. 46 counties were without dentists.
The support of a bill like this would be the support of the entire health of our community.
Supporters say the proposed law would encourage more physicians to practice primary care and also encourage them to work in rural and underserved areas.
People are having to face some tough economic times, and this can help. Right now, the #2 issue in the country is health care.
Medical school graduates rack up debt, thousands in school loans. The proposed law would create a loan repayment fund for primary care providers who spend 4 years practicing in underserved parts of the state.
The bulk of the patients we have to deal with have nowhere else to go. We are truly a healthcare safety net provider.
In Port Arthur, Jessica Holloway, KFDM 6 News.
For House Bill 1876 would come from a restructuring of the tobacco tax. It would close a loophole that exempts smokeless tobacco products.